Hey everyone, I'm here with Dr. Stephen Hing, who's an ophthalmologist, and I asked him to come answer some questions about his career into surgery, ophthalmic surgery. So, for the people who don't know you, do you want to introduce yourself and what you do?
My name's Stephen Hing. I was for a long time head of the department at Westbury Children's Hospital, but now I'm sort of semi-retired. I still work at Campbelltown Hospital and I have a private practice.
What attracted you to ophthalmology in general?
I did an ophthalmology term as an intern, and ophthalmology, there's a bit of surgery, there's a bit of medicine, there's some procedures, and it was a very interesting specialty. And then on top of that, people are so happy when you improve their vision. For me, it was something that I really enjoyed.
Of the six senses, I think vision is probably one of the most important, and people will be most regretful to lose that one out of all of them. Would you agree?
Yeah.
If you had to choose one other specialty to go into outside of ophthalmology, I know this is a bit of a loaded question since you are very, very into your career in ophthalmology.
And also I'm old. But actually, if I was going to do something else, I actually would do general practice, because although ophthalmology these days is very sophisticated and more or less at the cutting edge, there's a lot of ophthalmology that's general. I like ophthalmology because you can be so general, and I think I would like general practice also. Yeah.
If there was something outside of medicine that you did to help you get into ophthalmology and become successful in ophthalmology, what was that one thing that you could attribute your success to?
So for me, I was lucky because I was just there at the right time, and the career path sort of opened for me. So that was good. I think that having a good heart and a good community, or like a heart for the community, and wanting to help people, it counts a lot. And the thing is, ophthalmology training is popular, and they keep changing the ground rules. So it's very hard to make any sort of recommendations of what to look for. But generally, you have to think that I would do myself that helped me get into it. I think it was just being there at the right time and having the right heart to do it.
If you would like to share a patient story that really stuck with you over the years, maybe even in your internship or your med student time, what would it be?
I'll give you an instance of how things have changed since. So when I was an intern, an ophthalmologist that I worked with made an error and covered it up and told me, don't tell this to anyone. I'm sure he's passed on now because that was a long time ago. But I really like the attitude of today, where we have open disclosure and we tell people up front. If we all make mistakes from time to time, and it's good to be upfront about it, own up to it, tell the patient so everybody's informed, and then you don't have any worry about, for instance, I don't know whether he was worried or not, but you don't want these things coming back to haunt you later on if you keep quiet about things. And it's not fair to the patient either. So that would be my story to share.
And if you had one piece of advice that you would give to anyone who wants to get into ophthalmology or is interested in the specialty, what would you give?
Wow. Well, like I said, it's like the other colleges. There are criteria, there are points, but they keep changing the criteria and the points. So it's really hard. But I suppose being prepared, just doing the groundwork to know about the training program, to know what the criteria are as you get closer to the point where you have to make the decision and do the application. You've got to check more then, because they would have changed the point system from a couple of years before that. Yeah, so do your homework. Yeah.
I think that goes for all the competitive specialties, that most of the groundwork is laid out early. And a lot of the times you realize that you're up against a lot of the more senior people as well, maybe moving laterally between specialties. So I think that's also a big point of interest as well. But yeah, thank you for talking with me, and all the best. Cheers.